Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about GLP-1 drugs. They've been the recent new rave in medicine for weight loss, and those drugs include drugs like Ozempic, Wegovy, Tirzepatide, things like that. And they are usually injections that you do once a week, and they basically suppress appetite and cause you to lose weight very quickly. The problem is that if you don't maintain on a small dose, a maintenance dose, you gain your weight back. My mother was on Ozempic and she lost 50 pounds in 6 months. And as soon as she came off, they did not put her on a maintenance dose, and she gained the 50 pounds back in 3 months. So it's a very tricky drug, and it's also got a lot of side effects. So I'm not saying not to use it, but I am going, as a naturopath, I'm going to tell you that if you watch what goes into your mouth and be careful about the sugar that you eat, the carbs that you eat, and the amount of protein and fiber and vegetables that you eat in a way that would mimic a Mediterranean diet. I think that a weight loss program utilizing that method is far healthier than using a GLP-1 drug. However, there is new research to suggest that GLP-1 drugs, GLP stands for glucagon-like peptide. And glucagon-like peptide actually is naturally produced in the gut. And it signals, well, or I should say, it regulates blood sugar, stomach emptying, and it signals fullness, stomach fullness to the brain. Well, these are all really important eating cues. But interestingly, the other thing that it does, and this was a byproduct of finding out about GLP-1 drugs, is it is a very good mast cell stabilizer. Now, all of you know what mast cells are, or most of you do. Mast cells are immune cells that produce histamine in response to an allergen or an antigen. So, a lot of patients of mine that have complex chronic illness, and in particular those that have an allergic constitution or have mold allergies, have an elevated histamine response, and they are very reactive to the environment. This is because histamine is readily dumped into the bloodstream by the mast cells when an allergen or an antigen is present. So interestingly enough, the application of GLP-1 drugs, which is a weekly injection, to patients that have mast cell difficulties and patients who have MCAS, which is mast cell activation syndrome, these patients, their mast cells, for some reason, they calm down quite a bit. And the reason that that's important is that histamine is pro-inflammatory. And so if you have infection already and you add histamine, it's like adding gasoline onto a fire. It just makes the inflammation much, much worse. So the application of GLP-1 drugs is now being used in patients that have MCAS with a certain degree of success. I'm not going to tell you that you get 100% better using GLP-1 drugs, but they do seem to help stabilize the mast cells, which is important for patients who have complex chronic illness. So you might want to talk to your doctor about using a GLP-1 drug. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.